Good morning to everyone. You might have been saturated with quality now, and we are trying to see whether we can create some social values here. I was thinking that, anyway, thank you to the Dr. Gyani and Dr. Narotamburi, Mr. Govind Hari. I was thinking that you are going to talk in favor of socialization or socialized medicine or medicine rendered by the government pretty much whole. But I find that you are also in the middle path, and so I totally agree with all that you said. The only small thing I'm going to do is just to examine what is the context in which we should analyze that. Probably the Indian context is different from the international context. And we will all agree that health is a fundamental human right. But we should also agree that we have the fundamental right to seek quality health care and with accreditation, with infection control, and with patient experience. And so that's also our fundamental right. Universal health care is what we are talking about everywhere in India for several years, and yet a dream to be achieved. And ideal solution is yes, and I agree that ideally if the government can render that service, yes, I am with the government. Complete ethical and on-the-job training, all that preparations have to happen irrespective it is socialized medicine or is a private healthcare. But we should also understand that there is no kind of free lunch for anywhere in the world. So every service which we get in health service or any other service, it has a fee, it has an expense, it has a cost, and it has to be paid by someone. And when there is socialized care, which is coming through the government, and there are various subsidized systems, let it be Ayushman Bharat or CGHS and all that, or state systems like Karunyam, Arogyasri, everything has a cost, and the cost has to come. And in these cases, the government provides it through taxpayers' money. And whereas in major portion in private citizens, it is coming from out of pocket. And so the out-of-pocket expenses in India is about 60 to 70%. And also the out-of-pocket, I mean the private care, even today, especially the secondary and the tertiary care, is provided by private sector, at least about 60% all over India. There are various insurance schemes, trust hospitals, so it's a combination of factors. So that is why we have to look into a model by which we can coexist and see how we can survive. Quality, can we ensure quality with the socialized medicine? It's a challenge. Reduces innovation and competition because we have to think how we deliver care in our country. There is even advanced countries like Canada, which is the waiting list is increasing now and humongous. And NHS, the story is also not different, and they are also trying to see whether private insurances can be taken. So there is an additional burden of private insurance coming to the citizens in addition to the NHS. And efficient utilization of each pound or penny or dollar in the private sector happens much better. For example, I can say that, let us say the average length of stay, ALOS, I think that the government sector, probably it is a much higher number. I read somewhere 9 days, somewhere 14 days, whereas it's less than half in the private sector. And less morbidity, and the patient experience is always better. So we have to look at the cost also. The GDP, I think in UK it is about 12%, and in the US 14%. And if we want to give total socialized medicine in the US for an year, it will be $1.38 trillion they have to spend. I don't think even US can spend that. So failure of Obamacare, everyone knows about it. And I was talking to my Japanese friend during dinner yesterday, and and he said that it's an ideal care in Japan. I think there is no difference in the private sector as well as in the government sector. Both give very efficient, quality, patient safety care. So that's an ideal situation, but we have to look at it. They have about 12.5 crores population, and we have India about 150 crore population. Their growth rate is minus 0.5. Our growth rate is almost plus 1 or 0.8. So their GDP spending is about 8 to 9%, and India's spending is about 1.5%, both the government and the state put together. So yes, India's economy is galloping, and we may be third or fourth richest country in the world soon, but the population also is increasing. So the socialized medicine cost we cannot. And just as look at it, so we may have ration the care, or care rationing has to happen, and it will be a humongous burden in our GDP as well as for our country. If you look at it, healthcare is not such a hot subject in India, just like in the US or in the UK, because these are all very important election subjects over there. We are still, not up to that level. And whether we can give an equitable care to every citizen, like the universal care, I'm not quite sure yet. So where should we go from here? I think, like Mr. Govind had said, I will put it that an India model has to be created. And a public-private participation will be the most important thing which we may have to look at it. Insurance should be a part of it. The universal health care the government is trying to give, it should not be universal to everyone. People who are affordable have to be separated from that. Co-payment system has to be promoted. Primary and secondary care, perhaps the government and the socialized medicine can take care to a great extent, because we have got very good examples, the doctors and the nurses all being produced by the government. So that is a public-private participation. Other companies, other stakeholders, pharma, equipment companies, all of them should be brought into this to play a big role. And digitalization is in a big way in our country, and it is cheaper, and therefore we can definitely catch up and utilize that to reduce the cost. So in short, we want compassion and concern for the care. There was a slide, I think it hasn't come, and that is the latest Elephant Whispers, and the latest movie, the Oscar award-winning movie, and which says that, the woman and the bony, and taking care of an orphan reku elephant, and give so much affection and concern, and it reciprocates, no barriers between even animals and human beings. So why can't we have barriers broken between human beings themselves? So what if we join together as a team with concern and compassion, the government and the private sector, and that is where we can achieve many more things. Universal healthcare may be a dream, but quality healthcare we can provide to masses and millions more than what we are doing today. And that's my contention. Thank you very much for hearing.